Have you started taking medication for your prostate or perhaps for hair loss and noticed changes you weren't expecting? Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you're experiencing concerns about your urological health or the medications you've been prescribed, I want you to know you're not alone and there are answers. We're here to help you understand your body with clarity and comfort. Today we're going to talk about two medications that urologists prescribe frequently: tamsulosin, often called Flomax, and finasteride, known as Propecia or Proscar. Both can be life-changing for the right reasons, but they also come with side effects that many patients wish they'd understood more deeply before starting treatment. We'll cover what these medications do, how they work in your body, what side effects you might experience, and, perhaps most importantly, whether those effects will fade once you stop taking them. If this kind of honest, patient-focused content resonates with you, please consider subscribing and sharing this channel. It helps us reach more people who need clear, compassionate medical guidance. Understanding these medications. What are they and why are they prescribed? Let's start with the basics. Finasteride, Proscar, Propecia. Finasteride is a medication that works by blocking an enzyme in your body called 5-alpha reductase. This enzyme converts testosterone into a more potent form called dihydrotestosterone, or DHT. DHT plays a role in two very different processes. Prostate growth. Higher levels of DHT can contribute to benign prostatic hyperplasia, or BPH, which is non-cancerous enlargement of the prostate. Hair loss. DHT also affects hair follicles on the scalp, and in some men, it contributes to male pattern baldness. So urologists prescribe finasteride at a higher dose, usually 5 mmHg, to help shrink an enlarged prostate and improve urinary symptoms. Dermatologists and primary care doctors prescribe it at a lower dose, 1 mg, to slow or reverse hair loss. It sounds like a straightforward solution, and for many people, it is. But there's more to the story. Tamsulosin, Flomax. Tamsulosin belongs to a class of drugs called alpha blockers. These medications work by relaxing the smooth muscles in the prostate and bladder neck, making it easier to urinate. If you've been diagnosed with an enlarged prostate or are experiencing bothersome urinary symptoms, like difficulty starting urination, weak stream, or frequent nighttime trips to the bathroom, tamsulosin can provide real relief. But like finasteride, tamsulosin comes with side effects that aren't always thoroughly discussed during a quick office visit. Finasteride, how it affects the brain and your sexual health. Here's where things get more complex. Finasteride doesn't just work in the prostate or on your scalp. It also crosses something called the blood-brain barrier, which means it can affect processes happening in your brain. When finasteride blocks 5-alpha reductase in the brain, it reduces the production of certain molecules called neuroactive steroids. These include dihydrotestosterone, DHT, 5-alpha dihydroprogesterone, 5-alpha dihydrodeoxycorticosterone. Now, the science here is still evolving. Most of what we know comes from animal studies, but the theory is that reducing these steroids can interfere with the parts of your brain responsible for sexual desire, arousal, and function. What the data shows. According to the medication's labeling, fewer than 10% of users experience sexual side effects, which may include decreased libido, reduced sexual desire, erectile dysfunction, ejaculatory difficulties, general sexual dysfunction. That might sound manageable. But here's the concerning part. A study surveyed 71 men who developed what's now called post-finasteride sexual dysfunction after taking the medication for hair loss. The findings were sobering. Over 90% reported decreased libido, arousal issues, and erectile dysfunction. Nearly 70% experienced difficulty achieving orgasm. The average duration of symptoms after stopping finasteride was 40 months. That's more than 3 years. In 20% of these men, symptoms persisted for over 6 years. Let me be clear, this doesn't happen to everyone. In fact, if you've been taking finasteride for over a year without any sexual side effects, you're likely in the clear moving forward. But for those who do experience these effects, the impact can be profound, and in some cases, long-lasting. The nocebo effect. when expectation influences experience. There's another layer to this conversation, the nocebo effect. You've probably heard of the placebo effect, when believing a treatment will help actually makes you feel better. The nocebo effect is the opposite. When patients are warned about potential side effects, they may become more likely to notice or attribute symptoms to the medication, even if the medication isn't directly causing them. This doesn't mean the symptoms aren't real. It means that anxiety, awareness, and expectation can all play a role in how we experience medication. That's why it's so important to have open, balanced conversations with your doctor, so you can make informed decisions without unnecessary fear. Tamsulosin, how it affects ejaculation. Now let's talk about tamsulosin and alpha blockers. The most common sexual side effect of tamsulosin is reduced ejaculate volume, or in some cases, retrograde ejaculation, where semen enters the bladder instead of exiting through the penis. This happens because tamsulosin blocks alpha receptors in two key areas. 1. The bladder neck. 2. The seminal vesicles, which produce about 80% of your ejaculate. Normally, these areas contract during ejaculation to propel semen forward and out of the body. When tamsulosin relaxes those muscles, the semen may take a different path, or simply not be expelled in the usual volume. There's also a theory that tamsulosin may affect serotonin or dopamine receptors in the brain, which play a role in the ejaculatory reflex itself. How common is this? Studies show that 8 to 18% of men taking tamsulosin experience ejaculatory changes, depending on the dose. Interestingly, when men are informed ahead of time that this side effect is possible, about 70% say they would reconsider taking the medication. That tells us how important ejaculatory function is to quality of life, and how critical it is that doctors discuss this openly. Are there alternatives? Yes, if you're experiencing ejaculatory issues on tamsulosin, talk to your doctor. There are other alpha blockers with lower rates of this side effect, including alfuzosin, lowest rate, around 0.6%, terazosin, doxazosin. Silodosin, on the other hand, tends to have a higher rate of ejaculatory dysfunction, similar to tamsulosin. Your doctor can help you weigh the benefits and risks of each option, and find the medication that best supports both your urinary health and your quality of life. Will these side effects go away when you stop? This is the question that weighs most heavily on patients' minds. For tamsulosin, the good news is that the ejaculatory side effects of tamsulosin are generally reversible. Once you stop the medication, most men find that their ejaculatory function returns to normal within a few weeks. For finasteride, unfortunately, the answer here is less straightforward. For most people, sexual side effects resolve within weeks to months after stopping finasteride. But as we discussed earlier, a subset of men experience persistent symptoms that can last for years. This condition, post-finasteride syndrome, is still not fully understood. Researchers are working to identify who might be at risk and why the effects linger in some individuals. If you're currently taking finasteride and have concerns, don't stop abruptly without talking to your doctor. They can help you make a plan that prioritizes both your physical health and your peace of mind. What should you do if you're experiencing side effects? First, please don't suffer in silence. I know these topics can feel uncomfortable to bring up. There's often shame or embarrassment around sexual health, but I want you to hear this clearly. Your concerns are valid, and they matter. If you're experiencing side effects from tamsulosin or finasteride, 1. Talk to your doctor. Explain what you're experiencing and how it's affecting your life. Be specific. 2. Ask about alternatives. There are often other medications or approaches that can help. 3. Don't stop medications suddenly without guidance, especially if you're taking them for a medical condition like BPH. 4. Be patient with yourself. These changes can be distressing, but with the right support, most issues can be managed or resolved. If you feel dismissed or judged, please find another doctor. You deserve care that takes your full well-being into account. Closing thoughts. Knowledge is power, and so is compassion. Medications like tamsulosin and finasteride have helped countless men manage prostate symptoms and regain confidence in their appearance. They're valuable tools, but like all tools, they come with trade-offs. Understanding those trade-offs allows you to make informed choices. It allows you to advocate for yourself, and it allows you to approach your health with both hope and realism. If you're facing these decisions, know that you're not alone. And if you're already experiencing side effects, know that there are paths forward, whether that's adjusting your medication, exploring alternatives, or simply having a more open conversation with your care team. Your health matters, your quality of life matters, and your voice in your own care matters most of all. As always, take care of yourself because you're worth it. If this video helped you, please subscribe and share it with someone who might benefit. We're here every week with more honest, compassionate guidance on urological health.